Good morning, everybody. Go ahead and place all your personal items to the side. Laptops put away, cell phones put away and on silent. Folder people, go ahead and come and get your folders.
Why don't we go through his case just as a refresher? The two symptoms in the statement of chief complaint: nausea and vomiting. Good. Maybe some of this, right, when he took a handful of pills. And so it's just something to be aware of what he could have in his body. So hepatitis is a big one, STIs. Yeah, so he is sexually active, right? Because remember, we talked about our ROSE, which is our rule out worst case scenario. So your top 3 on your differential that you think you need to prioritize testing for as you get him stabilized. I want you guys to define what liver failure is. Like, is he actually in liver failure? And is he at what point would you want to consult a transplant service to say we think he needs a transplant and he's not going to recover? So change the sodium to 145. See if it changes it. No. Okay. So change it to 125. So let's change a parameter. Let's say he hasn't had he doesn't have renal issues. So change his creatinine to 1.2. What does that give you? Yeah, that's pretty good, right? Much better anyway. He's have a half and half chance of living three months. Not good because his INR is so high. Did he have a Tylenol level?
We didn't get it.
Not yet? Okay.
Just not a good one.
Okay. And then what kind of labs you would want to rule in or out? So someone who gets a liver transplant has to be on lifelong immunosuppression. They have to be on lifelong therapies. They have to be very compliant with everything. So social support is huge. Do they have the social support to maintain their transplant? Because that is a huge component of deciding if somebody gets an organ or not. It's whether or not they have they don't just meet the medical criteria and the clinical criteria, but they also meet the financial and social criteria that you need. Okay?